Welcome to Chit Chat with Gina, your host Gina Barbera. Today we're going to be learning more about the Physicians Premier Emergency Room, and we are in the Bulverde Spring Branch community where one of their locations have been here since 2017, and we're going to be visiting with Dr. Lonnie Schwertlich, who is one of the founding partners. And we're also visiting with Jennifer Meacham, who is the Regional Marketing Director. And just thank you all so much for your time. I know you, especially you're super busy. So thank you. Yes.
Yes, thank you for having us.
Yes. And so just tell me, I know that you're all in pink. So tell me a little bit first about that, because it's one of the things that probably people who are watching are wondering about.
Yeah, and I got nominated to be one of the Men in Pink, which is a organization that is put together to raise awareness of breast cancer. So we will, for the whole month of October, have to wear pink and do a bunch of events trying to raise awareness as well as funding for cancer research. So it's been a fun thing to get into, and it's going to be a busy October.
It really is.
Yes.
And if I know you, Jennifer, you've got lots of things planned for the community that you're doing and you're involved in?
Yes, we're so excited because the American Cancer Society is the one that has this Men Wear Pink South Texas campaign. And so for our physician founder to be nominated is such a huge honor. So as soon as we found out, of course, we rallied all behind him. So yes, Premier is going pink in October. And so we're super excited to have fundraising events that'll be in the community. And also our staff has the opportunity to purchase t-shirts as one of our fundraising events. So you'll see the staff if you happen to come into the ER,
wow.
which hopefully you don't, but if you do have an emergency and you come in here, you might see a staff member, instead of their scrub top, they'll be having a pink t-shirt, and on the back it'll say Mammogram Save Lives. So just to get that message out on the importance of breast cancer awareness and how we can get ahead of the game.
That's awesome. So, Dr. Schwertlich, I think that you're originally from Corpus Christi, is that correct?
Correct, yes.
So, and then you've been here since 2017, and I'm just curious, what brought y'all to the Bulverde Spring Branch community?
Well, we started these in Corpus Christi with the attempt to try and help the hospitals. We were all working in the hospitals previous to that. Hospitals were inundated with patients. Wait times were humongous. So we were trying to figure out a way to increase the efficiency of our ERs, and then realized it had to be over the whole system. So the only way to do that was to increase access points by putting the freestanding emergency rooms in the community closer to where the people develop their emergencies so they can get the care as quick as possible and have faster access to that. So in the process of doing that, we built 5 in Corpus Christi, the center, and then the 4 points of Corpus. And then the next thing that happened was a friend of mine that I had been the EMS director for in the Valley, Mr. Ballinger, had apparently moved to this area, and they were having trouble here with the EMS systems being able to cover the Bulverde area. Wow. So the Bulverde area was growing so quickly that they were having to purchase ambulances to keep the place covered. So there were 3 ambulances at that time, and it cost $1 million per ambulance to maintain it per year. And so what they did is, with the long transit time into San Antonio, as well as the overloaded hospital ERs and the San Antonio areas, the EMS system here was overtaxed because an ambulance, all 3 ambulances would be in transit or waiting to unload at the hospital. And many times the city, the area here was not covered. Wow. And so Ballinger said, I know one of the gentlemen that started when he's freestanding in Corpus Christi, maybe we could get them to come here. If we could get a center put here, then we could unload here, or at least get the people to come over and follow them over here so that they can get the care locally and be able to save that transit time and be able to be back in service and cover the community better. And so we met with the city council, and they showed us this site, and here we are.
Amazing.
Yeah, and it's so important. He always, Dr. Schwertlich always talks about that golden hour. And if you want to talk about that, Dr. Schwertlich, how important it is for us, these freestanding centers, to be in these small communities.
Yes.
Yeah, so that is the goal of emergency medicine, is to get you the care as quick as possible, which is called a golden hour. During that golden hour, you have the best chance for survival and the best result afterwards with the least amount of disability from whatever injury you sustained. So, and that goes with heart attacks, strokes, trauma, everything. So having these sites in communities where everybody can get to them within that golden hour is vital to that. And that is one of the big goals of the freestanding industry now, is to get these centers all over the United States in communities like this, because it would be nice if we could have a full hospital in all of these small communities, but the footprint is too expensive for a hospital and they can't survive. Whereas a smaller footprint with just the emergency room with a real efficient system can survive it. Now, you still need the volume, and you have to have the people using the thing in order for it to survive. But it is vital to have them closer to that. So we have started out putting them into communities now. One of the things we're working for to better serve the community is to be able to get the ability to see and get reimbursed for Medicare and TRICARE and Medicaid. There's a bill called the Emergency Care Improvement Act that we're trying to get passed in Congress right now. It's it's HR 1964.
Oh my goodness.
Jody Arrington, Vicente Gonzalez, and a host of both sides of the table. I mean, Democrats and Republicans are backing this, trying to get it pushed through, which will allow freestandings to be able to be taken care of Medicare and TRICARE.
That'd be big, right?
Well,
to
yes.
do that.
And so during the pandemic, with everything inundated, all the hospitals inundated, the most sensitive to that virus, of course, was the elderly.
Right.
And the ones that we really ought to serve well is the military. And that's what CMS recognition gives us. So we went to the Congress with all of the support of all the legislators in Texas, asked CMS and the Congress to please give us a temporary waiver during the pandemic to allow us to take care of the elderly and the military during this time. So they gave us that temporary waiver, and that went through the pandemic. It ended May the 11th. So May the 11th, it ended. But what we found is all of the population are elderly, the family of the elderly, the military, their families have become very dependent on us and relying on us. And so what we have all decided to do in the freestanding industry is to continue to see the military and the elderly and just see them for free, hoping that that bill will get passed. And when the bill gets passed, then we might get reimbursed. So essentially now we're taking care of the elderly and military out of our own pocket. And
my goodness. So
it's the right thing to do.
It's the right thing to do. And in reality, we want to take care of the whole family. So the only way you can do that is take care of grandma and grandpa as well as everybody else. And so that's what we've been involved in. And that bill is extremely important to get passed this year.
So helping it to get passed is obviously giving people awareness. And so would that be something that people would be able to vote on this coming?
But the legislators will vote on it. It's in the Ways and Means Committee right now with Jody Arrington and the group trying to push it through. They need to, what you need to do, everybody out there needs to contact their congressman, their representative, and any person of political push and ask them please support the Emergency Care Improvement Act. It is a bipartisan bill. All it is to add an amendment to the Affordable Care Act that says that emergency care is that care provided in the four walls of a hospital, or, this is the amendment, in a state licensed facility licensed to practice emergency medicine, which is what freestandings are.
Okay. So tell me a little bit about y'all's facility. I know that the equipment and everything. So if you could go into a little bit about that, Dr.
So 2009 was when freestanding emergency centers were first licensed, and we recognized the need that we need to do something in these communities where people can get the care quicker. So we enacted a bill. A group of physicians and legislators in the state of Texas put together a bill to develop this system, which is it has to have a full emergency room capabilities just like the hospital with all the same equipment, CAT scan, ultrasound, x-ray, all the lab. We have EKG, we're able to treat heart attacks, strokes, everything just like the hospital. But we're actually required to have more than the hospital does because the hospital's emergency rooms are not required to have a physician on duty 24 hours a day. They can have a physician on call. Freestanding emergency centers have to have a emergency room trained physician in their facility 24/7, 365 days a year. So we have to be better staffed than the actual hospitals do. And so,
And he is still practicing. He still pulls 24-hour shifts. So not only is he our chief medical officer, yeah, so he's amazing.
I'm just curious too. So, I mean, because Jennifer, you're very involved with the community and the schools and helping to, I guess, getting involved in doing some good things. Can you tell me what Bulverde Spring Branch is saying about?
Absolutely. Well, it was very easy to come in and join this family physician premier because that's what they treat the community as, is family. They consider themselves part, just like Dr. Schwartlich alluded to before. We take care of the entire family from the babies all the way to grandma and grandpa. And so it's very important for us to be there, not only inside our four walls of the ER, but outside the community too, and to give back and to be present there as well. So just like you said, we're involved in the schools, in all the athletic programs to support that. And then also the chamber is really a huge part of the community. And so we're partners with them as well, just to support the local businesses as well. And they support us. So it's a very symbiotic relationship. And it's just a fantastic community.
Okay, awesome. And so just, I know we're going to be just giving a wrap up here just a sec, but I want to also just make sure, if someone comes in, and do they get seen right away? Is that, I mean, obviously when you're in an emergency, and what is actually considered an emergency besides the evidence of a stroke or that somebody should come to?
Yeah, well,
your
emergency
facility
is basically any injury or disease that is life-threatening or limb-threatening. And the difference between like freestanding emergency centers and the hospital emergency centers is the hospital emergency centers are obviously attached to a hospital. They're usually inundated, hard to get to, in big shopping centers where there's tons of people in there, have to get to the parking lot or right in there through ambulance. You typically get in there and they're so packed, their waiting room is so packed that you're seen by a nurse. A triage protocol is initiated, which is, well, you got chest pain, we'll do a chest pain protocol, which hits everything that possibly can cause that. And then you sit and wait until you get a chance to get pulled back. Well, and by putting these out in the community where they're less crowded and less inundated, plus not attached to a hospital, so they're easier to get to. It allows the people to get in there quicker. So we see patients usually within the first 5 to 10 minutes of arrival. We initiate care by a physician, interviewing them, seeing them right away, ordering specific things that need to be done for that problem, and fine-tune that. And that is resulting in us being able to take care of patients actually 23% cheaper than the hospitals do, because we fine-tune our exam and workup rather than the hospital where they have to do a triage protocol because they're so backed up. And then because we initiate care so much quicker, we end up being able to get people well quicker. We also, when we have to admit to a hospital, we're able to pick and choose which hospital has the best capability at that particular moment to take care of that emergency. So you have a heart attack that comes in and you have 3 hospitals that have the ability to take care of heart attacks, and you know this one is the best one right now by the staff that you know that's there. You can try and send that patient straight to it. But if that one is occupied, you know that this one over here is second best, and so you can at that particular time get it the best place to take care of that emergency at that particular time. Whereas if you're in a hospital, you're stuck with whatever you've got there. If like the cath lab is backed up with 4 patients, you got to wait for those patients to go through. Whereas if that cath lab is backed up, we go to the next one. So we get you in for surgery, for trauma, for bleed, for heart attack or stroke as quick as we can to the facility that can best take care of you at that particular time. We also only send patients to the hospital to a floor. We do not send them to the emergency room if at all possible. The only time they go to the emergency room is when there is something that needs to be taken care of right then and there, and they're not able to get that in the room. But we do that because our whole purpose in this was to augment the hospitals, not compete with the hospitals. We're here to augment the hospitals to make it so that they can better take care of the patients that they have there. If we then send our patient in there, then we plug that ER up as well. So our whole mission in this is to give the best possible care, the quickest care, get the best result, but also to unload and make those hospitals as better function and make them better be able to take care of the patients that they have as well.
That's amazing. And it just seems so awesome that y'all are here in the Bulverde Spring Branch area because it is just
It's
exploding.
booming. It is.
Oh, yeah.
And so you definitely feel a big gap there that they didn't have before. So
Yes, it's definitely an experience. If you haven't been here, yes, I have 3 boys, so I'm in here quite often, and it is wonderful. You're treated with such exceptional care, with compassion, and they take their time with each patient and the family members.
Okay. So great.
It's concierge medicine.
Okay. And I know y'all are doing, you have locations that are expanding in San Antonio. Is there anything that y'all want to add before we close, maybe about those other locations?
We have one in Cibolo. We have this one. There's also Prestige. There's several other freestanding emergency centers in the San Antonio area that help serve the public in a similar fashion. And they're all friends of us. We have an agreement to try and stay away from each other as well as the hospitals so that we're spread out evenly and not compete with each other.
Okay.
And then the goal of this whole system is to be able to go out into all of those communities, like the rural communities. Because if you think about it, the hardest person to replace is a farmer or a rancher.
Right.
So the people out there in the breadbasket areas deserve to get exactly the same care that anybody does, and actually are harder to replace. And so you want them to get well as quick as possible. So the goal of this is to make it so we get that Emergency Care Improvement Act so that we can go into all those small towns, and then you have your freestanding emergency center there. They have the equipment that the local doc can use, so you don't have to send the people all the way into town to get their x-rays or CAT scan, and then provide for that whole community without a huge hospital, which we have found in a lot of those small towns. They put a hospital and it fails, it goes bankrupt. And so with the lesser expensive footprint and seeing patient for 23% less because you're seeing them quicker, that whole industry should help the thing. And the other thing we're thinking that will also go along with that is the freestanding emergency centers then will be kind of the medical center of that, with the family doctors sending patients in. We take care of them there. If we can send them home, because modern telemetry now, you can take care of people at home that would normally be sitting in a hospital getting a dose of antibiotics once a day.
Yeah.
Well, you think about it, you could have it with modern telemetry through your phone, send them home where they sleep better, they eat better, they recover better, and just have a home health nurse or a doc go by and check them once a day. Start their IV antibiotics so they don't have to stay in that big hospital and they recover.
Who wants to be in the big hospital anyway?
Plus you don't get exposed. The other thing is you don't get exposed to the bacteria and stuff that are in those big hospitals. And that's not the hospital's fault. They're doing their best to take care of people. The result is using antibiotics that causes resistant bacteria to pop up in those places. But trying to keep those patients away from that as much as possible would go hand in hand with what we're trying to do.
Well, I think the community is lucky to have y'all here. So just
and do you want
And did you want to add anything, Jennifer?
Yeah. Well, we the only thing that I'd like to add is that we do continue to expand, just like Dr. Schrolik said. So we'll be open in the Alamo Ranch area, which is huge. That community is expanding too. I grew up in that area, so it's very personal to me. So I'm so excited to have that support out there. So that'll be in the Petrenko area.
All right.
Yep. And we're looking at other areas too, because any area that gets the population growth there that will sustain one of these, they will need it because it's long
access and identifying that need. Right?
Awesome. Well, we want to just thank y'all for just joining in, and we're going to display the information if you would like to get more. And we want to thank you for listening, and have a wonderful October. Bye.
Thank y'all.